Thank you, everybody, for joining us. I'm Steph Goodman. I lead marketing, communications, and some partnership work for the Wisdom Study. I've been a participant in the study for over 6 years, and I've worked for the study team for just a little bit less than that. Just please introduce yourself in the chat if you haven't had a chance to yet. Can tell us your name, where you're coming from, and what brought you to the forum today. So I'm just going to lay out the format for today's session if you're new to these. This is in a meeting format, not a webinar format. So you can interact with our speaker and our facilitators. So please send your questions to us in the chat. You can also raise your hand. You can speak up during the discussion if anything if you have any questions or you need us to slow down on anything. And please ask your questions, because these community forums are to engage our community and foster learning and collaboration, and sharing ideas and having everyone stay current with what's happening out there. Usually our forums are around topics related to breast cancer risk. Today's forum is not related to breast cancer risk specifically, but is relevant for anyone who is a patient, and we all have been patients in our lives. Also, please mute yourself if you're not speaking, because we can hear a lot of background noise. The meeting is being recorded, and that's specifically for use. We put the meetings on our YouTube site so that people can watch them afterward if they weren't able to attend. And then at the end of the meeting, a little post-meeting survey will pop up and it'll be on your screen. And we'd love your feedback to hear about what you'd like to discuss in the future. So our mission is to move together toward equity and better outcomes in breast cancer for everyone. So this slide I'm showing right now just goes over the different community forums that we've had in the past. We've had a lot of different topics. And as I mentioned, you can find like 95% of our community forums are recorded and on our YouTube page. And we can put our YouTube link in the chat in case you're interested in getting some, additional education. Today, we're going to hear from Miss Andrea Downing. She is the co-founder of the Light Collective. The Light Collective is a nonprofit organization working to advance the collective rights, interests, and voices of patient communities as that relates to health technology. Andrea is the co-founder and board president of the Light Collective. The work that they do is helping patient communities protect their data and co-design technology that serves patients. Andrea is a BRCA1 previvor, and she became a leading advocate for digital privacy after seeing how health websites use tracking and surveillance tools. This past year, Andrea led the Patients AI Initiative, the Patients AI Rights Initiative, and she's going to be talking to us about this today. I felt this was very relevant because AI is being used everywhere and for everything, and even the Wisdom Study is going to be incorporating an AI technology to read mammographic breast density to aid in the precision of how we assess people for breast cancer risk. And so I really thought this would be helpful to you to learn about this organization that's working on a national effort defining how patients' rights and transparency and trust should shape the way that artificial intelligence is incorporated into healthcare. The initiative brings together patient leaders, researchers, and policymakers together to ensure that people and not algorithms are at the center of healthcare innovation. So that was a big mouthful, and I'm going to let Andrea share her screen now.
Thank you, Stephanie. And I just want to start by saying it is such an honor to come and speak with the Wisdom Study community. I have been not only a huge fan of the work that this team is doing. But I just think that this type of forum is such an important resource for the broader breast cancer community. And I'm going to be talking a little bit today about it is Breast Cancer Action Month, but it is also Cybersecurity Awareness Month. And I'm here today at UC San Diego and just spoke with the Center for Healthcare Cybersecurity. And as a breast cancer BRCA advocate, turned a security researcher, I'm really just excited and honored to share some of the things that I've learned and help reach out to the community. I will share my slides in just a second, but I also wanted to introduce my colleague who is on our board. His name is Mike Middleman, and he may be offering some color commentary along the way, deeply immersed in our work. Mike, do you want to introduce yourself real quick? And as you do that, I'm bringing up my slides. Oh, are you on mute? I don't know if I can hear you. Um, no audio, but that's okay. We're glad to have you, Mike. Thank you for coming and thank you for the support. The support. We're just so glad to have you here. So let me go ahead and bring up my slides. Stephanie, can you see everything?
Yes, yes, I can.
Okay. And the slides, so the topic today is patient community resilience. We're going to talk a little bit about some of the work that we've done at the Light Collective, but also the research that we've done and future directions that we want to take, where it would be so wonderful to continue this conversation because every bit of the work that we do is led by communities for communities, and it is truly the passion that we bring to this work, and wouldn't be anywhere without the advocacy organizations that we work with to advance research. Okay, so and do you just quick question, do you see what we'll cover, Stephanie? It says paused on my end, but I just want to make sure.
I am only seeing your first screen, the Light
Okay,
Collectives.
let me try this again. Shared desktop. Now it looks like it's going. I think I just had.
Yes, now I can see it.
So basically 4 parts to my talk today. Why listen to me? Who am I? History of patient communities and innovation in healthcare when it comes to technology. Some of the research that we've done, and Stephanie shared that we're going to talk a little bit about the Patient AI Rights Initiative, and we'd love to, partner for impact in different ways. And we're actively seeking people to join the Light Collective if they want to learn more. We're working with community organizations, and I'll share a little bit more about that. But let me begin with my origin story. So as a BRCA1 mutation carrier and a previvor, I've gone through my surgeries. And as I navigated making informed medical decisions, one of the most important, paths to my own healing was finding my community, finding people in my own community, previvors, people who were navigating uh, decisions about being high risk for breast and ovarian cancer and having to make decisions around that felt very scary. And in 2018, the other part of this story is I have a background in technology professionally. And in 2018, I started doing some security research after Cambridge Analytica and found security flaws and privacy flaws in the ways that Facebook groups were sharing information. Now, that's not the only thing that we've done, and I'm not going to go into all the things that I have been a part of since, but the gist of this is there's when we think about new technology, and when if for any of you who have gone through genetic testing and navigated BRCA1 in life, navigating, the risk, there's a lot of fear there too. So there's a common theme of facing fear that has been so much of my path in my work. And as we face fear together, um, sometimes the brightest lights along the way can be the people that help you find knowledge, find information, build trust, get the support emotionally and physically that sometimes you need in order to heal. And this picture is really important. This was our founding meeting, and some of the advocates that you see here were part of the BRCA community and my own support group. And they helped us to shape the vision for what the Light Collective is today. We are very proud that we, at this point, that picture is old, by the way. That was 2018. And we have spoken at the White House. We have gotten to teach med students at Weill Cornell and Stanford and other universities. We've published research in privacy and security that have helped to make an impact in policy and better protect communities and our privacy. Now, I don't want to give the impression that we've solved all the problems that there are on the internet or on places where our data might be shared in problematic ways, but we have to start where we are and use what we have and build our communities and networks to be more resilient. So that's what we're really here to do and why we're talking with you today. The Light Collective wouldn't be where we are without the incredible community leaders and advocates who along the way have joined to co-develop and co-create the research that we have. Our board is an entirely patient-led board. We're very proud of the fact that we have 36 patient-led organizations who have been through our training in our cohorts. And now we're kind of in this place where we're thinking to the future, looking at the past of research and impact that we've had, and working to build new partnerships in places that are going to have impact over the next 5 or 10 years. So let's start with the history of, some of our thinking at the Light Collective and building patient community resilience and innovating together. What can we learn not only from the breast cancer community, but also other incredible communities out there who are part of the Light Collective? So I want to begin with this. Give me 1 second. I'm going to go on pause. I had to sneeze. I'm sorry. I'm a little I think it's the allergies here. Sorry about that. Um, you know, Community partnership is nothing new, and I think the reason why we have the Wisdom Study Forum is we understand the importance of community partnership. Wilma, it's wonderful to meet you. And I was just listening as we were getting ready to start the call about some of the things that you're doing. From our perspective at the Light Collective, that's really the most important type of work that we can be doing, because building these networks of trust in the fabric of a community is something that we want to protect. It's something that is healing. It's something that helps empower and inform people when they're diagnosed, not either with breast cancer or test positive for BRCA or for another condition. And these are like past research studies that I would recommend if you just want to take a screenshot of this. And the cover of this BMJ article is nothing like, this is back in 2013. So these concepts are nothing new. We're just looking to apply things in different ways, recognizing that across patient communities, we can draw from examples of what the HIV community did when they first developed AZT and got FDA approval and organized their networks to partner with and build research and clinical trials, or the type 1 diabetes community when they created an open source movement to forever change the way we monitor diabetes before the We Are Not Waiting movement, which happened on social media. People would wake up in the type 1 diabetes community every 2 or 3 hours to fill a bolus because the medical device wasn't updating. And they changed that by organizing and learning about the science, but then building these partnerships with the researchers who could help create evidence to inform clinical trials, and then build leverage that completely change the way we operate in healthcare. So these are just a few examples. Another in the breast cancer community is the development of Herceptin. So when we think about the research from the Light Collective, we are specifically looking through the lens of how we as communities engage online. And often when we fall through the cracks of the healthcare system, because perhaps we don't have access to the care that we need, or we don't have the knowledge and support that we need to get to the right expert or the right treatment, we turn to the tools we have available to us at the time. Sometimes that's social media, and sometimes increasingly it's becoming tools like ChatGPT or large language models where you can ask questions and get answers. And our perspective here is we want as communities to be able to have safe spaces. We want to have good knowledge at our fingertips. We want our privacy to be protected. We want rights. And this study, it's called Tangled on the Web. And if you click on or look, you can either go to that link or do the QR code there. This study was co-created by patient advocates and authored by Dr. Maya Rockymore Cummings at Johns Hopkins University. And what we did was we had our network of 36 organizations, 377 respondents really gave insight about some of their hopes and concerns, not only for social media, but also emerging concerns when we think about how artificial intelligence is adopted in our care. One of the strongest signals that we got from this research, and here our goal is polling communities and figuring out what the issues are that rise to the top to inform our strategy. And when we see that so many of our community advocates want to be informed, and not just advocates, but the broader community, we want to be informed if AI is being used in our care. The question is, how do we do that in ways that empower, in ways that teach, and help people understand what the benefits and risks are? When there are so many different types of applications of AI, Stephanie, you were mentioning one of the really powerful and emerging ones is using AI in mammography and radiology. There are many others when it comes to, for example, building alerts when you go into the emergency room to say whether somebody is at an increased risk for sepsis. And the design of these solutions truly need to be transparent. Patient communities need to be informed. And we're asking ourselves, just at a very early stage, how do we partner to do that well in ways that are worthy of our trust? Over here on the right, I'm not going to go into all of the ways that we were also learning about the concerns that patient communities have. But I think it's really important here to say, studying what the concerns are and really being able to study what potential risk may be, and when adopting a new technology, so that we can lower those risks, so that we can design more resilient systems, is really, really important. So what came out of that is what we have, the work we've been doing for the last year and a half. With funding from the Gordon and Betty Moore Foundation, we brought together 13 nationally recognized advocates who have really been, I think at the beginning of this project, we were all like getting pulled into these, if anybody's been pulled into a patient panel to speak on a thing and you're like, I don't know why I'm on this panel. I need to educate myself. I need to educate my community. We were starting at the advent of ChatGPT 3.5 to be in different forums pulled in to give the patient perspective, but we weren't creating a forum for these advocates to learn from each other, debate, and then start coming up with our own shared principles of what our priorities are when we talk to health systems or companies and institutions that are thinking about things differently than we are. These are the 7 things we came up with. And I would say the one big thing that I take away from this project, um, first of all, it was really interesting in the beginning. Some of the funders and not the funders, but some of the people who are kind of not in the patient community were like, how are you going to get all patients to agree? And we were like, well, let's find common ground. But I don't know, how do we get all scientists to agree? We debate, not all scientists agree. And it's about this building evidence, the scientific process, and then building these partnerships to really inform the policies that we have. So when we think about the AI rights initiative, right now, these 7 things have not yet been operationalized. And we are doing the work to take a shared message to some of the forums that are informing procurement policies at health institutions or creating codes of conduct and standards. And we're just in the early stages of this. We have a lot of work to do. But what this has looked like, again, here's I think I flipped the slides, but this is a patient AI rights initiative. These are kind of the standards, and to get really geeky on everybody, there are a lot of places in artificial intelligence where researchers are evaluating artificial intelligence for safety, security, effectiveness, and we're creating really good ways to evaluate. And if you look at this map, the dark blue is like very detailed, operationalized ways to evaluate for specific use cases, different types of AI. But if you look at all the white space, the punchline here is the map is not yet the territory. There's so much work to be done. And our thesis here is so many of these evaluation frameworks are not asking patients what is most important, what we're concerned about. So how do we establish that patient community voice and quickly and effectively and sustainably build that so communities who need to be part of these conversations have the basic education that they need, have the resources that they need to effectively, just like we learn how to be a part of research or clinical trials, be a part of the design of AI or any technology. So where have we been? We're very proud to have taken the work we've done at the Patient AI Rights Initiative to federal agencies. We've spoken at the FDA. We've testified in front of the California Health Assembly. We have worked with the National Academy of Medicine, and we partnered with students at Rice University and co-published a paper. This work goes on, and it's been an adventure to see where people are kind of grabbing onto the message and asking, how do we support, fund, and operationalize the things that patients prioritize when we're designing AI? And that's, I put this slide up earlier at UC San Diego saying partnering for impact. These are the immediate needs where we want to be able to support the patient voice as we move forward and as we shape policy or I think about security research or getting ahead of digital harms so that we can have the innovations that are going to get smarter options to screen for, treat, and prevent cancer. But we're able to trust those things and transparently understand what's happening with our care.
Andrea, it's shocking to me that there's no governance around this. It's like hard to wrap my mind around that it hasn't been a part of this process as AI has developed and become so widespread that there's no real governance, especially around patients' rights. And I mean, I assume there is that HIPAA must be acknowledged and woven into these models? Or am I thinking about it wrong? That's one of my questions. And then my other question for you is when you talk about baking in impacting policy, um, are we talking like state policies or federal policies or policies
All the policy
like policies
impacts all the policies.
like at the institution level? Like, is that where we want to hold accountability or like, uh,
So I love this question, Stephanie. And we've had some conversations around the lack of governance that currently exists. My challenge right now is simply getting the right people who are making the decisions to understand immediate needs. And I think based on where we are in the current federal, like, let's just be really practical. We're in the middle of a government shutdown, and we've kind of turned our focus away when we've had a lot of impact in the past in our research informing policy at a federal level. When we talk about building resilience, there's such powerful tools in the lever, so to speak, when we think about at a health system level, recognizing that unmet need. So, for example, the very basic thing of I recently was at AACR speaking at the Disparities Conference, and oncologists brought up the same concern that you shared, where they don't know what the best practices are or what their institution is doing to protect patient data. And I'm getting anecdotal kind of signals of, well, some physicians may be using Chat GPT or putting patient data into Chat GPT or Claude or Anthropic tools. And so in order to that's a perfect example of the thing that we have to get ahead of. And when you look at this slide, the future directions would be, these are the things we think we can do right now, levers that we can pull, but we need partners to be able to test it and see how effective it is. Um, Very practically, when it comes to something like a procurement policy, I think the question is, how do we get tools in the hands of one health system and show proof? Like, what's worked for us well in the past is proof of concept that we know can scale in very practical ways to address an unmet need, and do this based on evidence that will inform a policy. Given, and again, having come from the FDA and being in the midst of a shutdown and the I guess there's a lot of chaos at a federal level right now. I don't think the cavalry is coming to save us soon, so we kind of have to lock arms as communities and ask the questions together. Does that make sense?
yeah, it really does make sense. I think from my perspective, and others may feel the same way that I do, I have just make an assumption that that there's like rules or guardrails, like, oh, well, everyone should know you can't put patient data in chat. But no, I mean, not everyone would know that. How would anyone, how would people know to not do that unless they're being told? So it's
Yeah.
yeah.
And I think here it's really coming to this problem with, you know, recognizing everybody's trying to do the best thing that they can, whether you're a patient trying to navigate and just seeking knowledge, or whether you're a physician, trying to get the answers that you need. I think we need to create kind of like safe spaces to be really honest about the things that are happening in real time, and then from there be informed to shape something practical that works for people. And and help people understand, and not in an adversarial way, but in a way that invites people to the table collaboratively. Mike, I see your hand is up. Do you want to jump in here? I
Yes,
don't know
can
if
you hear me now?
now I can hear you.
Okay, great, cool. I figured out what the tech problem was. So this is amazing. Thanks, Andrea, for presenting for the Light Collective here, and Stephanie and everybody. Thanks for having the Light Collective here, Stephanie. So I just to kind of bring this maybe home a little bit to help you think about this and everybody else on this call. So you work at University of California, San Diego, right?
I'm
UCSD?
I'm at
Oh, sorry,
Yeah,
UCSF.
I,
UCSF,
Mike,
right.
and I know it's hard to
UCSF.
keep track. I am
Yeah,
at Sandy at
yeah,
UCSD now but
right. UCSF, right. Sorry. Wrong UC. So, I guess I would ask you the kind of a question, right? So some of the things that Andrea has talked about here and that we think about at the Light Collective, when you want to get a new piece of clinical trial technology, right, to conduct a clinical trial, how do you typically go through with that? Right? If you think about the steps to
Mhm.
procurement for bringing on that type of technology, there are a number of steps that you might have to go through, right? That your institution may say, hey, you have to submit for this, you've got to submit
Yeah.
maybe a demand request, et cetera. Those are all the kind of guardrails that exist. Sorry, go ahead, Stephanie.
No, I was just thinking about, well, we have an institutional review board, so we would
Mm-hmm.
have to have them review changes to our protocol if there's a new technology that we want to use in the study.
Right.
Mhm.
Right. So my background, just so everybody knows, I couldn't figure out the sound earlier, but I'm coming to you guys from Philadelphia. I work in cybersecurity at a very large institution that's a health plan, a university, a number of hospital systems. So very, very timely discussion, right, for also my day job. And in my day job, we look at clinical trial technology, all of that, policies, right? And if you think to your day job as well, Stephanie, and for anybody else, you may get annual training, right, about what you shouldn't do, what you for data, right? Don't put it into a search engine, don't share it, don't talk about people in elevators, right? Don't share an email. And so one of the things we do is policies, right? And we try to train people around those things. But given that it's Cybersecurity Awareness Month, right? You'll probably have the opportunity to attend trainings, and one of the things that we all learn is that each of us is sort of the weakest link, right, for an institution, the people themselves, right? Putting data into like a chat GPT, right? And uploading it, or sharing other information that we shouldn't be sharing, clicking on links, right? So these are some of the things that we're proposing, but the procurement one will be a really interesting one for a future. Now, what I think is important to share is Andrea is not saying governance doesn't exist, right? Governance is beginning to exist, particularly around IRBs and other things, but the patient oversight and AI governance does not exist, right?
Mm.
And the rest of the landscape around AI governance, generally speaking, is still kind of shaking out, right? So this is the perfect time for an organization like the Light Collective and some of the things that we're pushing forward to get into the mix, and for organizations like IRBs maybe to bring us into the mix, right? Maybe that's a really good place for us to think about, Andrea, IRBs. But
yeah, I
happy to
think
be
that's
here to answer.
we're so early in this process. We're saying future directions. I
Yeah,
would love to, I think we see how quickly new technology like ChatGPT is just taking over, or new opportunities to save time, to do these things. And while the structures for security and safety may be out there, I think, Stephanie, to your point, not everybody in a large hospital system or network, a broader network, or even in the patient community might be aware of or know the reason why we have those safety checks because of the hard learned lessons from the past, right? So I think, we're taking the time to ask the questions now, try to get ahead of and build that resilience before we get too far down the path. Yeah, there might be 4 ideas we have, but there might be others. I would definitely say these are the things we think may work based on our experience. But I think I think we should open up two things I want to say. I wanted to just finally acknowledge the patient-led organizations and the co-creators of the Patient AI Rights Initiative. Thankful to Gordon and
We just lost Andrea for a minute. Andrea, I'm not sure if you can hear me, but I don't hear your
She
audio.
she was about to say thankful to the Gordon Betty Moore Foundation for funding the AI Rights Initiative. But I think we lost her picture as well. So maybe she can dial in. But I think she wanted to open it up to the floor, is kind of what it sounded like. So let's see if we can get Andrea to dial in. Otherwise, she asked me to be here to help with anything. So I'm happy to continue in the slides, or maybe we just wanted to start taking some questions, Stephanie.
All right, let's see. Does anyone in the audience have questions? I have lots of them, but I want to give people an opportunity to chime in so that I don't hog all the time.
Oh, and Stephanie, let me share before anybody asks a question. I'm a chronic disease patient, right? Lots of chronic illnesses, and including end-stage kidney disease, a number of kidney transplants over the years, and I am familiar with the Wisdom study, very much so beforehand. My mother passed away from ovarian cancer, and I've lost some family members to breast cancer as well. So very familiar with the great work you guys are doing.
Oh, well, thank you so much. It was our founder, Dr. Laura Esserman, actually had met with Andrea. I can't remember where they met, but Laura met her and said, you got to check out this organization. They're doing such really important work. So our leader has a lot of integrity and is really innovative in so many ways. And I'm grateful that we got the connection with you. So what I'm curious to know about these initiatives, like how do, same question that I had before, I guess, is do you try to work with people in the political sphere to shape policies around these issues, or is an approach to go directly to institutions like UCD, UCSD, or UCSF? Like,
Yeah, that's a great question. So we're the organization in itself, and I think a lot of your folks on the call know this, right? You have to be very careful around how much you lobby versus other types of efforts that you take on when you're a nonprofit, right? So you lobby too much, right, and go to folks too much, you lose your 501c3 status, right? So we definitely try to work on policy. I wouldn't say we lobby, right? But we definitely approach folks. So, one of the things that I think we're very proud of, in the Light Collective example was one of the folks who broke the news about the Metapixel, which was the HIPAA kind of tracker that was following people, and worked with Office of Civil Rights to get that to be considered a HIPAA breach. So in that sense, we work directly with sort of policymakers, right, and folks at the federal level, and to say, look, this is sharing information improperly, right? This deserves to be a HIPAA breach, deserves to be a privacy breach, and we need to have it considered as such, right? We do work with a lot of folks in different ways to try to get things to become policy. So Andrea mentioned the National Academies of Medicine. We work with different members of the Light Collective, work with their local officials to try to enact things on a local level. And then when we do have a chance to get to Washington, D.C. or other places, try to work with folks to try to transform, policy a bit. We have a lot of members of the collective, right?
I'm back.
Hey,
Okay.
So
Well, we
sorry.
just opened the floor,
Yes.
Andrea, to questions. So we're just starting to take questions. So
and
Stephanie, yeah, go ahead.
thank you, Michael. I'm gonna again pause so others can ask a question, but if I don't see a hand, I have a burning question that I actually tried to ask Andrea about last week and we hadn't had a chance to review it. Gonna give a few minutes. Does anyone want to put a question in the chat?
And again, sorry for the connectivity. I feel like I planned this really well, Mike. Mike was my pinch hitter to come in just in case that happens, and it did. So I'm so glad it happened at the end of the presentation, right when we were going to questions.
Okay, so then I'll just ask my question. I'm going to share my screen for just a quick moment for others to see.
Sure.
So there's this organization called CHAI. It is the Coalition for Health AI, and their mission is to advance the responsible development, deployment, and oversight of an AI in healthcare by fostering collaboration across the health sector, including industry, government, academia, and patient communities. And it says that their members represent increasingly diverse perspectives from nearly 3,000 organizations. So I want to understand. I became familiar with this group because I read something having to do with the current administration, I think, pushing back on CHAI. I'm not totally clear what was in the news a few weeks ago, but that's what led me to CHAI. So I was wondering if you could tell if you are comfortable at all sharing with us what did happen in the news regarding CHAI, if I read that correctly. The other thing I want to know is how is what you're doing different than CHAI? Oh, do we lose you again? Oh, hold on. You're muted.
She just on mute.
I just came off mute. Stephanie, you're going for the heavy hitting questions here.
Yeah.
I love it. All right. So I'm going to start with saying that when it comes to evaluating AI, if you refer back to the paper that I had where I said the landscape is not the territory, I'm going to get that paper and put it in here and CHAI is included. But there are a ton of these newer emerging AI evaluation frameworks that are coming out. The one that we directly partnered with was the National Academy of Medicine. And so while I don't want to, and there may be members of CHAI here, so I don't want to say, good or bad things about one evaluation body over another. But what I will answer is what is different about the Light Collective and the Patient AI Rights Initiative. So the first thing, and give me a second, I have to sneeze. Well, it is not my day. So the first thing I will say is we set out to be able to establish the patient voice in a different way. And I'm going to go back and kind of repeat and just say the same message in a different way of, oh, Stephanie, you're sharing. Can I share that slide on evaluation frameworks? Okay.
I just stopped sharing.
So here we go. Everybody see this?
Yes.
So my thesis here that I will say is the map is not the territory. You know, there are real problems that Chai set out to tackle, and the way that they present their model is um, basically a membership model that requires the health systems or tech companies that are involved to pay into a membership. And in doing so, that gets you kind of access to the resources at Chai and the standards at Chai and ability to evaluate AI based on the Chai standards. And as a standards body or a membership-led organization, that is a common model in other areas of healthcare. So I will say that there's nothing new about that model. We are not attempting to be Chai, and I want to be very clear that we do not in any way replace any one of the evaluation bodies that are emerging here. I will say that some are better than others, and the missing piece in all of them across the board is the patient voice. So the one thing that is different about the Patient AI Rights Initiative, and I hope if I can give you one thing to take away, if you are an advocate on this call trying to learn about AI and you want to really like look through the lens of all of these new initiatives and say one thing, it's this. When we are developing and deploying a new AI solution, we need independent duty to patients. When you go into a doctor, you have a doctor-patient relationship that has a legal fiduciary duty of accountability and to first do no harm. That is very, very important. You know, when we replace big parts of the decision-making process or the ways that we predict risk by automating with AI, there's some ways that can save a lot of time, and time does equal lives. But if we don't do that right, or if we are optimizing for profit or the opportunity to disrupt a new industry without thinking about that duty of care, we get ourselves into dangerous places. That is why the centerpiece of the Patient AI Rights Initiative is patient-led governance and independent duty to patients. If we can't state the value of implementing AI back to the ultimate stakeholder and think about in the design of AI, what are we doing to make patients safer? What are we doing to improve care? Then in our estimate, we were not doing enough. And it's not to say other initiatives out there aren't doing great things, and we are here to partner with them. I hope that answers your question. Are there any follow-up questions?
Thank you. That does answer my question. I was wondering if you could articulate what was it a controversy? Was that the administration was saying that Chai should not be?
So I'm going to purely speak from the and again, I think if you go look for Stat News, the article there
Yes,
was with Coalition for Health AI,
yes, yeah,
and
that's where I saw it.
the prior issues were around this was last year. There were board members from the FDA who sat on the Chai board, and I think the pushback was that both in last year's headlines and this year's, there's no requirement. Like the perception had been you have to pay into the Chai membership in order to access the FDA or approval of,
Oh,
you know, the or to be able to evaluate AI and safety from Health and Human Services or the government's perspective. And there cannot be that kind of moat around one organization creating regulatory capture, if that makes sense. And again, I cannot speak to personally the extent to which I would suggest go read the stat article for
Yeah, I'm looking for the article. I think that it was our federal administration. People can find it if they want. It was October 2nd. It was all over the news that our administration was pushing back on Chai as an organization, saying that it would hinder entrepreneurship and innovation. So that's
I
actually
think
what I'm referring to.
the hard parts here are also, you can take any argument like this and I guess use the rhetoric of an argument in good or bad faith.
Yeah.
And so, I think we're trying to always kind of stick with the be on the side of the patient and recognize that evaluation landscape, the groups like Chai, there's another one called Health AI Partnership, also based out of Duke. They are doing some phenomenal work. We try to focus in on the groups that are actively bringing in patient participation and insights, the ones that are really proactively working to keep the work free from conflict of interest, and making sure that we have access for patient communities first and foremost, and safety of patient communities is the top priority.
I would say also, Stephanie, I would say, the continual differentiation that will not change, right, is the Light Collective is founded and run by patients, right? Chai is founded by clinicians and run by like very, very large companies, right, that have a vested interest in the space. And I know I see a hand up. There's a Larry Smith's hand up.
Yes, well, you've actually kind of answered my question. I don't know anything about Chai, but I was concerned about whether or not they had the medical background in order to make some of these decisions and correlations between what AI could really be responsible for and how it would correlate with patient background data, et cetera. Is there any kind of political affiliation? What exactly do these people bring to the table when it comes to making these types of decisions, as opposed to some of the established medical societies that come up with recommendations and guidelines?
So I would say that there is, and I'm going to go back to the slide. Any one of these evaluation frameworks that you see in this paper published in Nature Medicine have a pretty strong representation of clinicians and experts. It just depends on the type of expertise.
Okay, all right.
And Larry, I'm glad you asked that, because one of the important parts here is the way that a group of cardiologists developing standards for AI's use in ambient scribes is going to be very, very different than or the hereditary community, cancer community may come up with or think about in terms of use cases. So I think a first step, of course, is to be working with the experts who understand clinical guidelines. The cancer community, we think about NCCN guidelines. And are we improving a standard of care when implementing an AI solution? Like, how do we measure that? All of these groups are just in the beginning stages of figuring out how to do that.
I have another question, and if anyone else in the audience wants to interrupt me, please go for it. But I do have another question. If people, attendees are hearing this today, are interested in being part of the Light Collective, do you have Are you national? Do you have a volunteer base? Do you have like how do people join the Light Collective if they wanted to? Does it work that way?
I love this question and thank you. So I'm gonna go back to if you want to check out this QR code. So first of all, you can email me if you would like to follow up. My email is andrea@lightcollective.org. And if you like QR codes, we have a sign up here. I will say that our challenge right now is capacity. You know, like many organizations, we are stretched thin on staff and funding. And while we were able to do these incredible things with the generous funding from prior organizations, we're in this holding pattern where we're not bringing on new cohorts yet. We're just in the place of scoping and designing new cohorts that we may bring out and develop new projects for in the next 2 or 3 years. And so if you're interested, these are our immediate needs. These are the things we're hoping to do. And if you have ideas for us, if you have interest in getting involved, we absolutely want to hear from you. And our hope is that we start to build this larger network where we begin with, we'll share our newsletter, our updates. We'd like to keep people in the loop. And then when new opportunities for cohorts come up, we'd like to start sending out those opportunities as they come and as we get grant funding.
Awesome. So do you have a newsletter yet? Is that an active thing?
Yes, we do. We actually just sent it out for Cybersecurity Awareness Month. And if anybody signs up with this QR code, I'd be happy to send out the one we just sent. I can send people, if you're interested, the newsletter that has a few resources. Like we did a post on basic cyber hygiene and some of the good tools that are free and open source that you could use if you're trying to kind of scrub your online presence and good things that you might not have thought about. So some just practical resources that you may find helpful. At least I hope you find it helpful.
That's fantastic. So I'm going to put the website in the chat just in case anyone can't see the screen too well for whatever reason. It's lightcollective.org. So if you're interested, if you want to get in touch with Andrea, if you want to, check them out and get involved or get their newsletter, that's where you go. We are so grateful for the work that you are doing, and I'm so glad that Wisdom Study was connected to Light Collective. You're thinking about things that are so important for all of us in the research community and for our participants and for patients. So I'm just going to share my last screen here. So our next month's community forum is slated to be about our environmental exposures sub-study. It's a new study that's part of Wisdom that's being offered. It's a questionnaire that's being offered to people who are already enrolled in the Wisdom study. And the goal of this little sub-study is to understand if environmental exposures at home and at work should be included in breast cancer risk assessments. So that's next month in November, and there should be a little pop-up screen that comes onto everybody's screen now asking what you might be interested in learning about for upcoming community forums. Let us know. We like to hear feedback from our community so that we're presenting information that people care about. So these are some different topic ideas, and thank you again to Michael and Andrea. We really appreciate your time.
Thank you. It's truly an honor to speak, and we'd love to keep the conversation going.
Awesome. Take care, everyone.
Bye now.
Thank you. Nice to meet you all.